Written by Dr. Jennifer Ashton from Good Morning America, this segment aims to shed light on the complexities and hopes surrounding fertility drugs. For couples struggling to conceive, fertility drugs can offer a beacon of hope, providing a pathway to the dream of starting or expanding a family. These medications are designed to help women ovulate regularly, thereby increasing their chances of getting pregnant. Ovulation is a critical part of the fertility process, and these drugs can help regulate and stimulate this essential function. While there are several types of fertility drugs available, two of the most commonly prescribed are Letrozole and Clomid. These medications have been extensively studied and are often the first line of treatment for many women facing ovulatory issues. Understanding how these medications work and their potential benefits and risks is crucial for making informed decisions about your fertility journey. It's important to have a detailed discussion with your healthcare provider to understand the best options for your specific situation. Fertility drugs are generally recommended after a couple has undergone a thorough fertility evaluation. This comprehensive assessment helps doctors pinpoint any underlying factors contributing to infertility, ensuring that the chosen treatment is tailored to the couple's unique needs. This evaluation helps identify any underlying factors contributing to infertility, such as hormonal imbalances, structural issues, or other medical conditions that may be affecting fertility. Letrozole and Clomid are oral medications, making them a convenient option for many women. These drugs are typically taken for a specific number of days during the menstrual cycle, under the guidance of a healthcare provider. However, it's important to remember that these medications are not a guaranteed solution and may not be suitable for everyone. Each couple's fertility journey is unique, and what works for one person may not work for another. Always consult with a fertility specialist to explore all available options and find the best course of action for your individual needs. Letrozole, originally developed as a breast cancer treatment, has emerged as an effective fertility medication. It belongs to a class of drugs called aromatase inhibitors. Aromatase is an enzyme involved in estrogen production. Letrozole works by blocking the action of aromatase, ultimately leading to lower estrogen levels in the body. Lowering estrogen levels might seem counterintuitive for fertility. However, it's important to understand the delicate hormonal balance required for ovulation. When estrogen levels are too high, they can suppress the release of other important hormones, like follicle-stimulating hormone, FSH, which is essential for egg development. By reducing estrogen levels, letrozole encourages the pituitary gland to produce more FSH, thereby stimulating the ovaries to develop and release mature eggs. Clomid, also known by its generic name clomiphene citrate, has been a mainstay in fertility treatment for decades. It belongs to a class of drugs called selective estrogen receptor modulators, SERMs. Clomid works by binding to estrogen receptors in the brain, essentially tricking the brain into thinking estrogen levels are low. This perceived drop in estrogen levels prompts the pituitary gland to release more FSH and luteinizing hormone, LH, another hormone crucial for ovulation. The increased levels of FSH and LH stimulate the ovaries to produce and release mature eggs, increasing the chances of fertilization. Clomid is often the first-line treatment for women with unexplained infertility, or those with ovulation disorders like polycystic ovary syndrome, PCOS. Both letrozole and Clomid are effective in inducing ovulation and achieving pregnancy in women with certain types of infertility. However, studies have shown that letrozole may have a slight edge in terms of live birth rates, particularly in women with PCOS. Research suggests that letrozole may result in a higher quality of eggs and a more favorable uterine lining, potentially increasing the chances of successful implantation and pregnancy. However, it's important to note that individual responses to these medications can vary, and what works best for one woman may not work for another. Section 5. Dosage Guidelines. Letrozole and Clomid. In this section, we will delve into the specifics of how these medications are administered and the factors that influence their dosage. The dosage of letrozole and Clomid is typically tailored to the individual patient's needs and response to treatment. This personalized approach ensures that each patient receives the optimal amount of medication to maximize their chances of success. Your doctor will consider factors such as your age, diagnosis, and previous response to fertility medications when determining the appropriate dosage for you. Other considerations may include your overall health, any underlying medical conditions, and your treatment history. Letrozole. The starting dose of letrozole is usually 2.5 milligrams per day, taken orally for 5 consecutive days, typically starting on day 3 to 7 of your menstrual cycle. This regimen helps to stimulate ovulation by increasing the levels of certain hormones in your body. Clomid. The starting dose of Clomid is typically 50 milligrams per day, taken orally for 5 consecutive days, also starting on day 3 to 7 of your menstrual cycle. Clomid works by blocking estrogen receptors, which in turn stimulates the release of hormones necessary for ovulation. Your doctor may adjust the dosage based on your response to treatment, monitoring your progress through blood tests and ultrasounds. These tests help to ensure that the medication is working effectively and to make any necessary adjustments to your treatment plan. Regular monitoring is crucial to achieving the best possible outcome. Section 6. Timing is key. When to take your medication. Both letrozole and Clomid are typically taken for 5 consecutive days early in the menstrual cycle. The specific days on which you should take your medication will be determined by your doctor, but it's usually between day 3 and day 7 of your cycle. Day 1 is considered the first day of your period. It's crucial to follow your doctor's instructions carefully and take the medication at the same time each day. Consistency is key to ensuring optimal effectiveness. Your doctor will likely schedule follow-up appointments to monitor your response to the medication and make any necessary adjustments to your treatment plan. Section 7 Visual Guide Letrozole and Clomid explained clearly. Section 8 Potential side effects, what to watch for. Like all medications, letrozole and Clomid can cause side effects. It's important to be aware of these potential reactions so you can manage them effectively. Most side effects are mild and temporary, but some women may experience more bothersome effects. These can vary from person to person. Common side effects of both letrozole and Clomid include hot flashes, which can be quite uncomfortable and may disrupt daily activities. Other frequent side effects are headaches, mood swings, bloating, and breast tenderness. These symptoms can affect your overall well-being and quality of life. Less common but potentially more serious side effects include ovarian hyperstimulation syndrome, or OHSS. This condition requires immediate medical attention. OHSS is a rare but potentially serious condition that occurs when the ovaries become overstimulated. Symptoms can include severe abdominal pain and swelling. Multiple pregnancies can also occur. This means you could be carrying twins, or even more. While carrying twins can be a blessing and bring joy, it also comes with increased risks that need to be carefully monitored. These risks include preterm labor, gestational diabetes, and high blood pressure, which require close medical supervision. Vision disturbances are another concern. These can range from mild blurriness to more severe visual changes. If you experience any visual changes, contact your doctor immediately. Early intervention can prevent more serious complications. It's essential to discuss any side effects you experience with your doctor. Open communication ensures you receive the best care and can manage any issues effectively. Section 9. Choosing wisely factors to consider. Choosing between letrozole and Clomid involves careful consideration of individual factors and preferences. While both medications are generally safe and effective, certain situations may make one drug a more suitable choice than the other. Factors favoring letrozole include polycystic ovary syndrome, or PCOS, a history of Clomid resistance, and concerns about Clomid's potential anti-estrogenic effects on the uterine lining. On the other hand, factors favoring Clomid include its long-standing track record of success, lower cost compared to letrozole, and its availability in generic form. Section 10. Conclusion: finding the right fit for you. Ultimately, the best choice between letrozole and Clomid depends on your individual circumstances and medical history. Working closely with your doctor is crucial to determine the most appropriate treatment plan for you. They can assess your specific needs, consider potential risks and benefits, and guide you toward the medication that offers the highest chance of success on your journey to parenthood. Remember, every individual is different, and what works best for one person may not work for another. Open communication with your healthcare provider is essential throughout your fertility journey.